Hi everyone, I'm Lianet Esteban, and today I'm going to walk you through an important neurological condition that we may often encounter in occupational therapy, a spinal cord injury at the C5 level. I will breaking down the neuroanatomy, clinical signs and symptoms, how it impacts occupational performance, and the tools we use in occupational therapy to assess and support these clients. The C5 spinal level is part of the cervical region of the spinal cord located near the base of the neck. This level controls key muscles like the deltoid and biceps, allowing for shoulder movement and elbow flexion. However, injury here cuts off motor and sensory signals below these points, meaning that the trunk, hand, and lower body function are lost or severely limited. While some sensation may remain, voluntary movement of the hands and fingers is not possible. Most C5 injuries are caused by trauma, car accidents, sport injuries, or falls, but they can also result from non-traumatic causes like tumors or inflammation. These injuries are not progressive, they don't worsen over time, but recovery depends on whether the injury is completed or incomplete. Most clients will live with the condition for life. Through with therapies and supports, they can achieve meaningful independence. Clients with C5 spinal cord injuries typically present with paralysis below the shoulders, ability to bend elbows but not move their hands or fingers, limited sensation below the level of injury, difficulty breathing deeply due to the weakness of the diaphragm. They often require adaptive devices, caregivers assistance, and specialized OT support for daily activities. In occupational therapy, we focus on restoring independence in daily life. For C5 injuries, clients struggle most with dressing. They lack of control and hand grasp. Adaptive tools or caregiver help are needed. For toileting, requires good balance and fine motor skills, both of which are impaired. And feeding, clients may be able to self-feed using specialized utensils or splints, but without hand function, it's a slow and frustrating process. We analyze these activities through the lens of performance skills, client factors, context, and available supports. To track functional abilities and guide our interventions, OTs use a variety of tools, including the American Spinal Injury Association Impairment Scale. This scale is used to assess motor and sensory function and specific spinal cord levels. The Spinal Cord Independence Measure, this comprehensive tool assesses functional recovery in various ADLs, including self-care, mobility, and social domains. Quadriplegia Index of Function is a functional assessment especially designed for individuals with high levels of spinal cord injury. And the Canadian Occupational Performance Measurement, which helps clients set meaningful goals in their recovery journey. Occupational therapists should take the following precautions. Autonomic dysreflexia, be aware of triggers and symptoms, and have a plan for management. Skin integrity, monitor for pressure sores due to the impaired sensation and mobility. Orthostatic hypotension, implement strategies to prevent dizziness upon standing. Monitor fatigue and breathing. C5 level clients may have partial diaphragm involvement, meaning their breathing can be shallow or labored, especially during exertion. They may also tire quickly, so it is important to build in rest breaks, use energy conservation strategies, and refer to respiratory therapies if needed. This diagram illustrates how the location of spinal cord lesions influence a person's physical function and level of independence. Focusing on the cervical lesions located at the top of the spine near the neck, we see that the injuries at this level, such as the C5, results in the most significant motor impairments. Individuals with the cervical lesions typically require power wheelchair for mobility, as they may retain only partial arm movement, such as elbow flexion, but lack hand functions and trunk control. Spinal cord injury at the C5 level presents unique challenges, but also opportunities for growth. As occupational therapists, our job is to provide hope, creativity, and the right tools to help clients engage in life again. From dressing to feeding to achieve long-term independence, our interventions make a difference. Thank you.